Hi, I'm Taylor.
Hi, I'm Kaylee.
Hi, I'm Tamara.
I'm Katie.
I'm Catherine.
And I'm Rebecca, and today we're going to be discussing the TR profession in a mental health setting. 20% of Canadians will personally experience mental illness in their lifetime.
In Canada, only 1 out of 5 children who need mental health services receives them. We're going to take a few minutes to speak with Kara, a recreation therapist from Thresholds Homes and Supports, to get an insider's perspective on mental health.
People don't understand the value and benefit of TR in a mental health setting. TRs engage clients in recreation programs to help their cognitive, social, and emotional needs. It's so important to educate people about the value of TR in a mental health setting. Some examples we experience are that our clients don't know what to do with their time and consequently can make negative choices. Also, their mental illnesses may have distanced them from family and friends, and as a TR, my role is to help make new connections for them. My biggest concern as a TR is with people not seeing the value of therapeutic rec and not getting clients out to participate. For example, clients have to come out and try recreation program once, or for those that have tried programs, it has now changed their life and they participate regularly. We need to change the awareness of TR and educate other professionals and our clients that TR can bring them what medications and medical support can't always. Yes, it's important for our clients to take medication, but along with TR support, we see recovery and enjoyment back in their lives. We can change people's perceptions of TR. Recreation is like a prescription for wellness and recovery, and this can be all accomplished through staff and community education. TR is relevant in mental health as it works well in this setting. Through the process of intervention, education, and participation, I'm able to help clients become independent in their leisure choices in the community. TR is relevant in so many different areas, not just mental health. We interact with so many different people that our approach may be the only thing we do differently while working with people with mental illnesses. Working in mental health, it's important to see the person first and not their mental illness. They are regular people, and it's important to stop the stigma. TR programs can benefit clients with mental illnesses in so many different ways. Clients with mental illnesses who participate in TR programs have shown a decrease in depression, decrease in stress and anxiety, increased independence, increased motivation, increased quality of life, reduce isolation, and strengthen mental well-being. My personal philosophy is play hard all the time and never ever give up on anyone. Clients with mental illnesses often need lots of encouragement and support from us.
Do you guys believe we should be using the medical model or the community model in TR?
Well, I feel like the medical model is better for insurance purposes, for medical treatments and medicine, and it's also better to create a universal understanding of anxieties and mental health. And it's easier to communicate with other healthcare professionals.
True. Yeah, I mean, I feel like the medical model is important, but if you look at the community model, you can consider the person as the whole person and not just their diagnosis. So you're not labeling people and you're not pushing that stigma on them. And also the client can be a lot more involved in planning their treatment process.
General anxiety disorder, according to DSM-5, involves excessive anxiety and worry occurring more days than not for at least 6 months about a number of events or activities. These individuals also find it hard to control their worries.
The anxiety and worry are associated with 3 or more of the following symptoms: restlessness, being easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbance.
According to the DSM-5, social anxiety disorder is marked fear or anxiety about one or more social situations in which the individual is exposed to possible scrutiny of others.
Individual fears that they will act in a way or show anxiety symptoms and be negatively evaluated.
Social situations almost always provoke fear or anxiety.
Social situations are avoided or endured with intense fear or anxiety.
Persistent and typically lasting 6 months or more.
Did you know anxiety is common in both genders, but twice as likely in females?
Anxiety is the anticipation of a future threat, unlike fear, which is in the present.
1 in 4 Canadians will have some sort of anxiety disorder throughout their life.
Anxiety often develops in childhood and tends to persist throughout the life courses if not treated.
Anxiety disorders are the most prevalent mental illnesses affecting Canadian adults.
Disorders differ from each other in the types of objects and situations that cause anxiety, fear, and avoidant behavior.
What is autonomy?
Autonomy is defined by self-determination, competence, opportunity, and independence.
Why is autonomy important for clients in TR?
Autonomy is important so that clients can freely choose their leisure activities, make independent decisions, and engage in activities that allow them to reach their full potential.
The medical model takes away people's autonomy because it labels and categorizes people based on an illness, and it takes away opportunities for choice. Having control is an issue in a medical profession due to the nature of many hospital stays, which include the administration of drugs. Patient autonomy sometimes has to come second in relation to health and safety of everyone within the unit, including the particular patient.
To break up autonomy down a little bit further, we're going to compare paternalism and parentalism. Paternalism is a means of controlling the degree of responsibility a person has. It would involve granting or taking away permission to make decisions based on perceived capabilities. Parentalism, on the other hand, involves gradual increase or decrease of responsibility as an individual earns trust and gains skills which help them to make responsible, informed decisions. TR is making a move towards using parentalism more often as it increases client autonomy.
Although labeling can be useful in that it allows clients to receive funding, resources, and treatment, at times it can also be a negative.
Within TR, we must be careful with labels. They may prevent or limit a client from attending recreation programs. For example, an assumption may be made that because an individual has been labeled with social anxiety, a social program may be unsuitable for them.
Labeling can lead to early judgments and assumptions instead of viewing the person in a holistic manner. It doesn't take into account the entire person, their personal characteristics, for example, gender, age, and ethnicity.
This judgment may then cause self-fulfilling prophecy to occur. The individual may start to believe that they are defined by their label, and their anxiety may worsen.
How's my anxiety patient doing? I have many patients who experience anxiety. Therefore, I don't know who you're talking about because I use person-first language.
What do you mean? What's person-first language?
That's when you put the person before their illness because it does not define who they are.
Oh, that makes sense.
How do you feel when you participate in TR activities?
It's a safe place where people are very understanding for what you're going through.
Do you feel that therapeutic recreation has helped you overcome some of your anxieties?
Some of them, yes. Once you get over the hump of going for the first time, it becomes easier.
Has TR benefited you in any other ways?
It's helped me make healthier choices and become more active in my daily life.
How do you feel about your relationship with a therapeutic recreation specialist in comparison to a doctor or a psychiatrist?
Doctors and psychiatrists treat you more like a number or a label rather than a person.
For people dealing with anxiety, TR can help by
Creating a distraction from negative thoughts.
Teaching coping strategies,
Creating social skills,
Helping clients connect with others,
and building a support group.
types of programs that are beneficial for anxiety and mental health, and things to keep in mind. Know how to adapt program for an individual who has anxiety. Types of programs for anxiety are guided imagery, yoga, horticultural therapy, art therapy, and group chat. Things to be mindful of when working with clients who experience anxiety and mental health are:
do not generalize. Everybody's anxieties are different.
respect boundaries,
Be empathetic.
Don't rush the process. Take the time to get to know your client.
and know their triggers and when to back off.
Here comes the sun, doo doo doo. Here comes the sun, and I say it's alright.